We had a really good time in the last 5 to 6 years because we have 7 new approvals in just 5 years, which is amazing, I guess. And we are coming in metastatic melanoma, just to give you an example, from 6 to 9 months median survival time in the year 2010, we are coming to a median survival time of at least 25 months now. I mean, that's a major improvement. It's tripling the survival time of patients. And as you know, median doesn't mean that everybody is dead at 3 years or so. It means that we have also the chance for long-term survival. And you know, the latest data on ipilimumab, the first drug which was approved for metastatic melanoma in the new time, you know, was 20% after 5 years. And now we are heading to 30–40% 5-year survival, and this is a major improvement. So which drugs were responsible for this improvement? Number one was, as I mentioned before, ipilimumab, a CTLA-4 antibody. However, the response rate was relatively low and there was some toxicity. In particular, it was autoimmunity. The drug which was coming next was PD-1 antibodies. They were tripling the response rate of ipilimumab, namely pembrolizumab and nivolumab. And you know, they were showing that the survival time is doubled compared to ipilimumab, which is another improvement over the so-called existing standard of care. So the new standard of care for BRAF wild-type patients and eventually also for BRAF mutated patients is the PD-1 antibodies. And to close up with immunotherapy, we are expecting the approval of ipilimumab and nivolumab as combinational immunotherapy in just 2 months from now. And we haven't seen the data on overall survival, but progression-free survival is superior compared to either ipilimumab or nivolumab alone for the combo. So it looks like another major improvement. And this is one side of the options of the treatment of metastatic melanoma. On the other hand, we have the so-called BRAF inhibitors. 50% of patients with metastatic melanoma carry a relevant mutation, which is called BRAF mutation. And these patients have the option to be treated with specific inhibitors. And the development was vemurafenib first, followed next by dabrafenib. Both drugs were approved as single-agent BRAF inhibitors. Response rate in a range of 50 to 60%, 7 months progression-free survival, 20 months overall survival. And I was very happy because it's a drug which acts very fast. Patients are feeling better after just 1 week. But there is an improvement because both companies developed new combinations and they combined BRAF plus a MEK inhibitor. The idea is to shut down 2 relevant molecules in the so-called signal transduction pathway, which leads to proliferation of tumor cells. And now we have 2 approvals of BRAF plus MEK. One is from Roche, it's vemurafenib and cobimetinib. The other one is Novartis, dabrafenib and trametinib. And that's another improvement, not only of response rate, not only of PFS from 7 months to 12 and 13 months, but also in the overall survival as a clear improvement to 25 months overall survival. So we have, on one hand, immunotherapy, on the other hand, the BRAF inhibition. And if you ask me for the future, which comes next, it's combinational treatment approaches and combination of targeted therapies plus immunotherapies, but also of immunotherapies like ipilimumab plus nivolumab, which is called checkpoint inhibition. And I need to mention one last drug, which is of importance. In December, just before Christmas, another drug was approved, which is a vaccine. The first approved vaccine for metastatic melanoma. This is given intralesionally into cutaneous and lymph node metastases. The drug is called T-VEC. The trade name new is imlygic. And it's another interesting story because the agencies approved this drug, but it's a limited approval for just stage 3B and C patients with cutaneous and lymph node metastasis and stage M1A, which means the limited disease of stage 4 patients, which is advanced metastatic disease. And because I was touching the issue of combinations, imlygic is currently combined with ipilimumab in the trial. And we were seeing that there is the hope for improvement of at least response rates. We have no overall survival data available. And it goes to phase 3 already. in a combo of pembrolizumab plus Imlygic, or plus minus Imlygic. It's a randomized trial. And so it's not stopping. I think that's just the beginning of a new era in the treatment of metastatic melanoma.